Addicted in PA is brought to you by the Lackawanna County District Attorney's Office.
Many people deal with pain on a daily basis, whether it's chronic headaches, a sports-related injury, or simply a worn-out joint. But as Fox 56's Jane Adonisio explains in this week's Addicted in PA, it's the way we deal with pain that makes a difference in the quality of our lives.
When you go to see a doctor for anything from arthritis to a running injury, their job is to address the issues at hand, sometimes with prescribed medicine. But over time, medicine is not always the answer. Joining us now is Dr. Paul McCary. He is the clinical director with McCary and McCary Physical Therapy Consultants. Paul, how does the pain affect not only the body, but the mind?
Well, that's a great question. And first, we need to address what happens with an injury. Under normal conditions, the body sends warning signals, pain, designed to prevent injury. Unfortunately, sometimes these warning signals fail to shut off. The body avoids normal movements for recovery that can lead to weakness and deconditioning. People get stuck in what I like to call the pain loop, where pain leads to low tolerance and deconditioning, which leads to weakness and then in turn more pain. The key here is to interrupt this loop before it becomes more chronic. Now, in terms of the mind, to answer this, we need to discuss something that's called the pain threshold. Normally, your pain threshold is present with strenuous activities, such as long distance running, maybe heavy lifting. The brain sends a pain signal during activity as a protective mechanism. Fortunately, with opioids, the brain kind of gets rewired here, and pain threshold decreases. The pain starts before the activity.
So is there a way to manage the pain?
Yes, and truly this is where I come in. First, through aerobic exercise, such as walking or biking. Here, the body releases natural chemicals called endorphins and dopamine that decrease pain and make you feel happy. They're our body's natural opioids. We remind our patients that taking opioids interferes with this body's natural release of these protective chemicals. And second, through education. Explaining that pain does not equal injury. This leads to less fear and increased tolerance and improvement in quality of life. But I truly recommend that everyone talk to a healthcare provider and ask about natural and conservative solutions to your pain. There are many options.
Thanks so much, Paul. Great information. We now turn to Lackawanna County District Attorney Mark Powell. Mark, all too often, opioids are prescribed for pain. Do you think that's the source of the problem?
We know the vast majority of heroin addicts first get hooked on prescribed opioids. And while opioids may be medically necessary, they must be monitored closely. Doctors need to do pill counts, tox screenings, and when they stop opioids where necessary, they need to wean a patient off those opioids and not just stop them cold turkey. Our medical community really needs to make a holistic approach and consider options like physical therapy and counseling in addition to prescribed medication.
Thanks so much, Mark. For Addicted in PA, I'm Jane Adonisio.
Jane, thanks so much. For more information about physical therapy, counseling, and recovery, head on over to our website, fox56.com, and check out the Addicted in PA page.